Brought to you by Agilus Diagnostics.
हेल्थ टेस्ट की बात आती है तो मैं भरोसा करता हूँ इंडिया's largest diagnostics company, Agilus Diagnostics. खुद को टेस्ट करते रहो.
5 years after COVID-19 disrupted the world, another virus is making headlines: Human Metapneumovirus or HMPV. The virus, which has caused concern globally due to its outbreak in China, has now been detected in India. But should one worry about it? How is the virus similar to COVID-19? Is there a vaccine for HMPV? Could it be the start of another pandemic? And more importantly, is the world ready for another pandemic? Hello and welcome to another episode of What the Health. Amid the rising human metapneumovirus or HMPV scare, the top medical body, the ICMR, on Monday alerted that the virus is already in circulation globally, including India. However, it noted that India is well equipped to handle any potential increase in respiratory illnesses. But the question is, what is human metapneumovirus? Well, HMPV is a common respiratory virus that causes both lower and upper respiratory infections like cold. It is a seasonal disease that usually occurs in the winter and early spring, similar to RSV and the flu. Respiratory illnesses in China align with seasonal variations caused by viruses such as influenza, RSV, and HMPV. In India, 7 cases of HMPV have been confirmed, with infections reported in Bengaluru, Nagpur, Tamil Nadu, and Ahmedabad. Among these, a 3-month-old baby in Bengaluru has been discharged, while an 8-month-old baby in Fad is still recovering. In Gujarat, a 2-month-old child has been diagnosed with the virus. Meanwhile, health authorities have clarified that none of these patients or their families have a history of international travel. Union Health Minister J.P. Nadda has reassured the public, stating that there is no risk of a COVID-19-like outbreak and the situation is fully under control. But HMPV is not a newly discovered virus. It was first identified in 2001, according to US Centers for Disease Control and Prevention. Is HMPV similar to the COVID-19 virus? Well, in several ways. Both viruses cause respiratory illnesses in people of all ages. However, young children, older adults, and those with weakened immune systems are at a higher risk. The symptoms overlap, including cough, fever, nasal congestion, and shortness of breath. These are also commonly associated with COVID-19. Both viruses spread through secretions from coughing and sneezing, close personal contact, or touching contaminated objects or surfaces, and then touching mouth, nose, or eyes. Karnataka Health Minister Dinesh Gundu Rao has also stated that the strain of HMPV found in these cases is not yet identified, and there is no available data on the strain detected in China. He emphasized that this is an existing virus and there is no reason to panic. But what are health experts and authorities saying? Now, Delhi health authorities have issued an advisory to prepare for potential health challenges linked to HMPV and other respiratory viruses amid growing cases in China. Former CM Arvind Kejriwal on Monday urged the centre to take immediate action based on lessons learned from the COVID-19 pandemic to prevent the situation from escalating. So could this be the beginning of another global health crisis? Are we prepared this time, or could this signal a new pandemic on the horizon? Well, if you talk about treatment and vaccination, currently there is no vaccine available for this virus. The treatment focuses on managing symptoms. There are a few tips to prevent HMPV, what you can do to reduce the risk of HMPV. Well, you should wash your hands frequently with soap and water for at least 20 seconds. Cover your mouth and nose while coughing or sneezing. Consider wearing a mask and avoid close contact with individuals who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. Practice self-isolation if you experience any symptoms. Individuals with pre-existing lung disease must be extra cautious and follow all precautions really gently. In case of any health concerns, consult your healthcare professional immediately. That's all for today. Stay informed and stay safe.